Another treatment that has been shown to have some evidence is something called cognitive behavioral therapy. It doesn't have as much research as any of the light therapies, but it does have some in it. And from the research that's out there, it seems to work pretty good. It can be used either in combination with light therapy or it can be used alone. And there's some evidence that it may actually work better in the long run than light therapy does. And cognitive behavioral therapy tends to focus on helping people to change their thinking patterns and to change their patterns of behavior to become more active and to stay in a pattern of behavior that's more like how you act in the summer, even as you go into the winter. And that can help you to have these more stable circadian rhythms and help with the SAD. And the final group of potential treatments are drugs, antidepressants, the most common of which are selective serotonin reuptake inhibitors, but there are other kinds that people can try out. Some people do that, take this in conjunction with light therapy. Some people take them on their own. It's really something that you would discuss in collaboration with your physician or nurse practitioner. Um, a lot of people like this route because it's easy to take a pill in the morning. Um, the problem is antidepressants can have some pretty serious side effects, usually not life-threatening, but with unpleasant side effects that some people really don't like. And so we often recommend light therapy because of the general lack of side effects. Um, but for some people, they prefer the antidepressants or they have relatively few side effects. And so it's a nice option for them. Now, you might have enough here to go out and figure this out on your own, but you might feel like you need more support. There are a number of ways you can get additional information. One of the best is there's a book called Winter Blues, which is a thorough guide to seasonal affective disorder. So if you're a reader and really want to learn a lot more, that's a great resource. Um, we have some handouts on our website, portlanddepressiontreatment.com. It's our specialty mood disorders clinic that's part of Portland Psychotherapy. We also have some resources for SAD on our normal website, portlandpsychotherapyclinic.com. We also are offering classes for people who could use a little more help. Some people find it's easier to implement these treatments if they have some coaching and some help. So in the winter time, in the fall, and in the middle of the winter, we're offering classes on helping people with the winter blues or seasonal affective disorder, and those can be found on our Portland Psychotherapy Clinic website. So if you've made it with me this far, thanks for sticking around, and I hope to maybe see you at one of our classes, or I just hope that this light therapy stuff and these other treatments work for you because they can really make a big difference in how the Portland winters are for you.